This is One-on-One. My colleague Joanna Gagis takes us to Virtua in South Jersey to see how this hospital is changing its approach to women's health through alternative medicine and more comprehensive care.
Women today have any number of responsibilities. They're employees, moms, executives, wives, caretakers. Many times they're the CEOs of their family, making very important decisions, especially when it comes to the health needs of the family. But so often they take care of everyone but themselves. That's why Virtua has dedicated primary and specialty care services just for women to help support them and in turn, better care for the family as a whole. I'm here with Kelly Nearstead, who is the Assistant Vice President of Women's and Children's Services at Virtua. Kelly, Virtua has really taken a close look at the needs of the women in this population in New Jersey. Why is it important that we treat the woman as a whole?
We actually went out into the community and asked women what it was they wanted from health care. And the answers were a little surprising. And I think what we heard was much less about those specific services and much more about what the experience is and how women really want to be treated as a whole. Women said loud and clear that they really wanted some alternatives to traditional medicine, complementary alternatives to treatments, integrated medicine options. They talked about weight management services, particular issues around menopause, issues with female incontinence. It's something that women don't really like to talk about. And I think there was a time when women would say, well, I had 3 babies, so of course that's going to happen, or it's part of being older. Women really want to take control for their health, and some of the services that Virtua wants to offer is in a direct response to what the community is telling us they need.
Dr. Polina Karmazin specializes in integrative medicine, which can be used in support of, and in some cases as an alternative to, traditional medicine.
In this practice, we mainly concentrate on complementary medicine, which includes acupuncture, homeopathic medicine, and biopuncture, among other things. Acupuncture has been around for 4,000 years. Biopuncture is a newer, very unique injection therapy where we combine homeopathic medicines with acupuncture.
What does that do for the body?
It stimulates more particular points.
And the purpose for that stimulation?
Well, the way acupuncture works, we place a very thin needle, as you can see, that's really tiny and very thin, and we place the needle into a particular acupuncture point. And by stimulating that point, the body can excrete certain substances, for example, endorphins, and that is a natural painkiller. It stimulates the body to heal itself.
What do your patients come in presenting that you're able to treat through your practice?
There is a really wide variety, from regular common cold to patients with knee pain, arthritis of the knee, back pain, neck pain, headaches. But also it's been proven that acupuncture can work to regulate the heart rate, the blood pressure, in patients who have insomnia, anxiety, irritable bowel syndrome, reflux. I also treat patients for weight loss and for smoking cessation.
Are you trying to, through the homeopathic medicine, replace Western medicine?
No, not at all. It's a complementary medicine, and sometimes it's much safer and has less side effects. And so some patients prefer to go that route. To some people, it's really like a miracle.
Mary Jo, describe the pain that you were living with before being treated by Dr. Karmazin.
Okay, chronic sinus pain. The pain was truly so bad. I said, I have to find something to relieve this pain. The first time I came in, she reviewed all my medical history. I gave her the history of all my surgeries. I gave her the history of my pain. And I think that's the key. You need somebody that will treat all of you, not just the 1 or 2 symptoms that you represent to them. She started me off with homeopathy, and then we started the acupuncture. I'm much better. My quality of life is much, much better. I would have to say I'm 1,000% better than what I was before.
I'm here with Dr. Mina Lazarus, who is the lead physician at the Virtua Women's Primary Care and Wellness Center. Dr. Lazarus, first of all, this is a beautiful office space, and this is what your patients walk into when they come to your office. Is that intentional?
Absolutely. One of the first things you notice when you come in is the relaxing atmosphere, the welcoming of the staff. It makes you feel more at home and more welcome in the doctor's office and makes it feel less scary to be in.
You spend a lot of time with your patients, getting to know them, screening them. Why is that time so important?
When a woman feels like she's listened to, she feels that she's comfortable enough to ask questions that she may not have asked before.
What are some of the things that you find because you dig and because you spend the time that otherwise women would be hesitant to bring up?
The most common thing we found are things like urinary issues, bladder incontinence, uterine prolapse, hormonal issues, menopause issues that normally women just think is a part of aging and they never would have brought up before had I not asked during our initial interview.
As a primary care physician, do you feel that it's your job and your responsibility to get to know every aspect of your patient's health?
Absolutely, and in this program, where women are given the time, we can find out about their social lives, their family lives, what stresses they have, what makes them happy, what makes them sad, and that all plays into a part into their medical care. It's not just the medicines that they're on.
Karen, how would you describe Dr. Lazarus' approach to you the first time you saw her?
She's very personable, makes you feel very comfortable. When I first started seeing her, I definitely felt like I could talk to her, open up to her. And as time goes on, I feel like it's more of a personal relationship than I'm coming to the doctor. I did just have a baby. And, you know, sometimes my feelings are all over the place. So you kind of have to wonder.
Is that one of the things that you addressed with Dr. Lazarus?
I did.
Explain that.
A couple months after I had my daughter, I was kind of feeling a little depressed. And not with her, just with myself. Just kind of feeling like I didn't know what direction I was going in or if I was doing things right, kind of second guessing myself. And I'm still feeling that way, and it's nice to be able to come and, you know, open up to Dr. Lazarus and just know that there's resources for me and that other people out there are feeling the same way.
Just butterfly bandages.
Dr. Colleen McCleary treats menopausal and premenopausal patients with bioidentical hormone replacement therapy using plant-based estrogen and testosterone that has the exact molecular structure as that in our bodies.
Somewhere around 38 to 40, we start losing our testosterone first, which we really didn't realize how important that was until recently. By the time you're 38, 40, you have about half as much as you had when you were in your 20s. And testosterone, we need that to make our moods better because it increases serotonin in our bodies. It makes us less irritable, less moody, less depressed. Makes us be able to handle stress that we couldn't handle before. It increases your libido.
Do many women know that they may suffer from low testosterone?
Not at all. They're shocked when they find out that that's what testosterone does for us. They're completely shocked.
As a woman, it's not on our radar.
They're only thinking estrogen. I need estrogen. I can't come to you until I'm having hot flashes and night sweats and not sleeping.
Both the estrogen and testosterone treatments are administered through pellet injections called exuberin. And what is exuberin?
What it is bioidentical hormones in pellets. And what we do with those pellets is we surgically implant them in the fat in your butt, and it keeps a constant state in your body. Versus if you were to take a tablet or put a gel on yourself or put a patch on. And all women are different. So, for example, you can last anywhere from 3 to 4 months, so you don't have to come as often.
How would you explain the way that this could change a woman's life?
This is the best job ever, like really and truly. Like my patients, you know, they come in thinking they're crazy. They think they're losing their mind. And I say, you're not crazy. We can help you. They come back. Within a week, their hot flashes and night sweats are gone. And they're just like, oh, thank you. I feel like normal again. I feel like myself. I'm not that person who is tired all the time. They're so much better that it just brings me so much joy because that's what I went into medicine for, was to help people.
Carrie, what life events led you to undergo hormone replacement therapy?
I started experiencing the common hot flashes that women do when they're going through menopause. They were embarrassing. I felt that I would get a little bit short-tempered and irritable, which really isn't my nature. I didn't find it fair to my family. It wasn't fair that they would have to suffer.
How would you explain the change that you feel in your life after you undergo the bioidentical hormone therapy?
Well, I almost feel it immediately. I was very impressed with Dr. McCleary because I found her very personable. She was concerned with my whole well-being, that not just my body physically, but my mental state, my spirit. I just feel like I have more energy and I'm happier.
Probably helps.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Healthcare Foundation of New Jersey, TD Bank, New Jersey Institute of Technology, New Jersey Natural Gas, MagnaCare, New Jersey Sharing Network, and by Verizon Communications. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.